Hey everybody, I'm Dr. Rob DiMartino, and I wanted to make this video for you today to talk about a phenomenon that we see in practice all the time when it circles around autoimmune disease. It's interesting because we get a lot of autoimmune disease patients, and we've been coaching doctors for the last 6 years to implement functional medicine protocols in their practices in order to be able to help these same kind of patients. And the thing that I always find fascinating is I'm not typically the first doctor that they've come to see. Of course, they went through the medical model, and maybe they've tried some other natural health practitioners. But one of the questions I'll always ask them is, well, what causes autoimmune disease? What did those doctors tell you causes autoimmune disease? And the answer pretty much across the board is, well, we don't know. So it's a curious thing of why would you go to a doctor and to somebody who says, well, we don't even know what's causing what the problem you have is, let alone we're going to try to treat it. So I wanted to make this video today to let you guys know that basically the cause of all autoimmune disease is what we become to call energetic debt. And I understand, and we'll go more into that in detail, but I understand the frustration that we all go through with as being doctors and dealing with something like this is because when we go through school, when we go through continuing education seminars, we're just not taught this information. And it didn't really change for me until I started having dinner with a friend of mine who's a PhD. He's a doctor, but he's not a medical doctor, but he's a PhD in physics. And I was complaining about something, about the curiosity of autoimmune disease, how we don't know what causes it. And he looked at me very curiously and just said, well, yeah, we do. And I said, well, we do? And he went on to explain to me through the physics of it. And I was shocked. After that dinner was over, I couldn't get home fast enough to get online and look it up. And sure enough, all of this data has been there since basically the 60s of what causes it and essentially what you can do about it. And at the end of the day, the baseline statement is, it's not a biochemical disorder. And it's interesting because, that's part of the frustration that functional medicine doctors get into all the time is half the time, we've helped so many offices put functional medicine programs in, but in the beginning portions, half of them don't even want to put it in to begin with. So, well, I don't want to do functional medicine because it's basically practicing medicine, doing allopathy with vitamins, which essentially I get, that's what it is. And at the end of the day, a lot of them don't want to do it because they don't want to take on the kind of cases that functional medicine attracts because, again, we want to do this to be able to really help these problems, not just manage their disease with vitamins. There's a benefit towards that, but it's not what we all got into this for ultimately, was to bring some sort of resolution to a more complicated type of problem. And when I went out, all over the country and all over the world, truthfully studying all these different ideologies of what you could do with these things, I was even kind of left hanging because there was really no answer in the biochemical world. But sitting with my friend, talking about the physics and how the physics runs the biology of it all, it started to become really clear. And in doing the research and having an explanation to the patients, we started talking about the ideology of energetic debt. And essentially what energetic debt means is that your body requires a certain amount of energy in order to make normal cell production. So if you think of your body as a business, just like any business, you need more money coming in than money going out. And the business of your body, again, just like any other business, has a product, and the product of our body's business is to make healthy cells. Well, that's a fantastic thing, but just think of it from a business perspective. If you have less money coming in than you have going out, well, now you create debt. Now in the body, the idea of money is energy. If you have less energy being created by your body than what you're expending, the product is going to suffer, and ultimately your cellular structure is going to suffer. And when your body starts building abnormal cells and abnormal cells and abnormal cells, eventually these are the cells that become your organs, your body parts. And your immune system looks at it and says, that's not normal. That's a huge mass of abnormal cells. They happen to be making up your thyroid. But your immune system says that's a tumor. It doesn't care if it's benign or malignant. It's not the point. The point is it's your immune system's job to get that out of there. So the immune system isn't confused. It hasn't gone rogue. It hasn't done any of these things. It's just trying to do its job, which is to replace those cells. Now, in the research, terminology like heteroplasmy, which is mutation rate, autophagy, apoptosis, all of these things exist. But when we're running truckloads of labs and then giving people a supplement for each thing that we find wrong on there without actually asking the question of what caused that to go wrong in the first place, there's no way you can measure this. So there's this huge gap between the research, the way it's clinically understood and applied, and even the ability to apply that because you have to get on a physics capability rather than doing it completely biochemically. These are the things that we found got practitioners like myself before I started doing all this stuck. And if you can overcome these things, you can start getting ridiculous results with these types of patients and starting them to get to a point of resolution far beyond what you would ever perceive before. And the reality is just understanding this concept of cellular repair, cellular replacement, and cellular death over the course of time changes the way that you look at the entire system and what is capable of being accomplished. So I hope this video was able to make some sense of a fairly complicated problem in a fairly short bit of time here. But if there's anyone you know would think this information is kind of cool, please feel free to pass it along. I thank you for being out in the trenches and working with these patients. Hopefully we'll get to see you soon.